Hi ladies, today we're going to be doing a slide presentation lecture on scheduling patients and how to handle different situations with cancellations and how to handle rowdy patients in the waiting room, different policies and procedures and things like that. So without further ado, let's go to our slideshow. Just bear with me while I get it pulled up. Okay, so establishing the appointment schedule. It is very, very important to be effective and efficient at scheduling patients. Scheduling allows providers to spend adequate time with patients. Patients need to feel their doctor spend enough time with them. Have you ever been to a doctor where it feels like they've kind of rushed in, did all these things and just rushed out, and you're left going, oh, I didn't even get to ask the question? Well, we don't want to have most of our patients feeling that way. The doctor needs to have adequate time to spend with patients, and so we need to be on top of our scheduling. Now, there are different factors that go into that, but we're not going to talk about that at this time. Factors for scheduling, you need to be aware of the provider's preferences and habits as well as the patient's needs. So here are some of the patient's needs. You need to determine office hours and appointment times that require consideration of the socioeconomic status of the area being served. The scheduler must allot visit time based on patient's needs and for individual visits. You have to balance between meeting the patient's needs and the provider's preferences and also available facilities. So here are some examples of some patient needs. The purpose of the visit, that's a need. Okay, what is the purpose? Is it a follow-up? Is it a new patient? Things like that. The age of your patient, the time needed with the provider. Is it a parent or a student? After dark travel time and able to take off work? Or the child with working parents? Provider preferences and habits. You need to consider the following factors. What does the provider want you to do about a packed waiting room? How does he want you to take care of over wait time for patients? Provider's promptness. Is your provider always 15 minutes late? Provider's ability to transition from patient to patient. Provider's break times, quantity or of time with the patients. Quantity or time with patients. Sorry, got a little tongue-tied there. Okay, so you guys are going to recognize this. All of you will. Even if you did not get to do a whole lot of SIMS charting, you're going to notice that this is an appointment matrix, and a lot of you have already gone through this, and some of you have just dabbled in it a little bit. Okay, the first thing that you're going to need to do in your appointment matrix is you're going to need to block out the time when the provider will not be able to see patients. Now I'm going to go back and just give you an example. So if you look at 8 a.m., Julie Walden, Dr. Julie Walden is going to make hospital rounds at that time. So she cannot realistically see patients in the facility or in the office if she's making her hospital rounds. And then you look at 11 a.m., Dr. James Marr, he wants to have his lunch at that time. Then I want you to look at 1 p.m. on Thursday the 9th. There's a block of time settled out, sectioned out there because Julie Walden is actually going to be going to a conference, so she can't see patients then. So that's what they're talking about. You're going to want to be able to block out different times when your doctors will not be able to see patients. Okay, next we're going to talk about a paper-based system. Okay, a paper-based system, you see a picture at the bottom here, are not used a lot now. I don't know any facilities that use them, but you know, I don't know all facilities. So let's just say that you're in an older facility that only uses a paper-based system. First of all, you can only establish those for up to 6 months at a time. Now, in a computerized system, you can set it up indefinitely. I'm just going to give you an example. Say that I go see my gynecologist tomorrow for my yearly visit. I don't need to see him again for another year, so I can go ahead and make that appointment for the next year, for 2021. So, you know, that's at least a year at a glance. So of that appointment being taken care of. Okay, when scheduling, make sure to allow enough time to complete a procedure. For example, you would never schedule a pap smear or a minor surgery in a 10 or 15-minute time slot. The shortest office visit type should be a follow-up or a recheck appointment. And you need to make sure that you know the policies and the procedures for office times. When you go to your facility, there's going to be somebody there to train you about that. Every provider facility is different, and they're going to make sure that you know what those things are. Okay, so in red it says provider reimbursement from insurance companies is partly based on time requirements for procedure visits. Some of you have not been through the evaluation and management CPT coding, but that's when this comes into play. The more time you spend, the more money you make. So if you're actually choosing E&M codes, you're going to need to make sure that you know how much time was spent. If on the medical record or on your super bill there's no time allotted, then you're going to need to query your physician to make sure that he's getting all the money due. So if you haven't been through evaluation and management, please do not worry about that. You're going to learn all about that at that time. Okay, now we need to talk about available facilities. Medical assistant must know how to pair patient needs with available facilities when scheduling. Knowing what equipment and rooms a practice has available will keep you from scheduling 2 patients at once who need the same services. I'm just going to give an example. Imagine if you are a cardiology clinic and every patient that comes in almost needs an EKG, but you only have 1 machine. You have to stagger your patients enough that you know whenever they come in, they're going to be able to use that machine. If your facility does nuclear stress tests and they own the equipment that's in the office and they do them themselves, you're going to have to be able to schedule that out to make sure you don't have 2 people scheduled for that nuclear stress test at the same time because there's only 1 machine. Computerized scheduling. Software programs vary from simple to more sophisticated ones that can select the best appointment time based on information that's entered. Also keeps track of future appointments. Printout of schedules helps staff and providers to stay on schedule. What that simply means is every day, and I think most EHRs have this feature. When you go in the morning, you can go ahead and print out a paper copy of the schedule. And that way everybody can have a copy and they know who's coming in. More than 1 person can access the schedule, so everyone is informed. Keeping everyone informed is key to having a workflow that moves forward. You're not getting too many hang-ups in your transformations from front to seeing the doctor to out the door. Okay, so let's talk about self-scheduling. I don't know if any of you have done this online in your patient portal, but you know, in this age of technology, a lot of people do self-scheduling. It allows the patient to use the internet to view a facility's schedule and select his or her own appointment time. It reduces the call volume to the office, and it's available 24/7 to the patient. You can also send email reminders the day before an appointment to request confirmation, and phone-in appointments must still be offered. So you can do self-scheduling, or they can call in appointments still. Okay, let's talk about legality of the appointment scheduling system. Appointment system must be accurate because it can be used as a legal record. Missed appointment should be noted in the medical record. In an appointment book, pencil is used so that the changes can be easily made. You need to include patient's name and phone number. An appointment book should be kept for state's statute of limitations and then shredded when discarded for privacy reasons. So again, that's talking about a paper record. There's 2 things that I want to go back and reiterate. I want you to understand that an appointment system can be used as a legal record. That's just really important that you make sure that you're accurate and you're on point with that. And also, missed appointments should be noted in the medical record. There's always going to be a place for you to make notes in the patient's medical record. Mrs. Jones canceled her appointment today because she was running fever and wasn't feeling well enough. Mr. White continually 15 minutes late to his appointments. Okay, now I'm going to tell you why here shortly, why those things are important. Why would I want to put in Mr. White's medical record that he's habitually 15 minutes late to his appointments? Okay, so now we're going to talk about the different types of scheduling. Time specified or stream scheduling. If you notice, I put you a little stream at the bottom of the slide. Each patient is given a time-specific appointment. This type of scheduling keeps a steady flow of patients moving through the office, like a stream, a steady flow. See what I did there? So your stream scheduling is a steady flow of patients moving through the office. Next is wave scheduling. You see, I put you some beautiful beach waves down there. It attempts to create short-term flexibility within each hour, assumes time needed for all patients seen will average out over the day. Rather than scheduling at intervals, several patients will be at the office at once and seen in the order of their arrival. Okay, so let's talk about modified wave scheduling. This allows time for urgent or walk-in patients to be seen. Okay, here's some examples. You have 2 patients come in at 10 a.m. and 1 at 10:30 a.m., repeating cycle throughout the day. Here's another example. Patients are scheduled to arrive at given intervals during the first half hour, then none is scheduled during the second half hour, because you're using that second half hour to finish up with the visits of the patient who arrived on the first half hour. I hope that makes sense. Okay, double booking. Booking 2 patients at once to see same provider is poor practice. So double booking is not a good idea. If that's the kind of scheduling that they do at the facility you go to, that is the doctor's prerogative. Okay, here's an exception. 1 patient will only take 5 minutes. Double booking should be avoided or reflected in the schedule. So the only exception to this rule is if you have a patient coming in, it's only going to take 5 minutes. Okay, in the red, it is not considered double booking if a patient comes to the office to receive a treatment by someone other than the provider, such as a patient receiving physical therapy or an anti-allergy injection. So the doctor isn't actually going to be the one doing that. So that's not considered double booking. Open office hours. A facility is open at given hours when patients are told to return in a couple of weeks for follow-up. Patients can come in at intermittent times, seen in order of the arrival. Eliminates broken appointments and prevents from running behind schedule. And most commonly used at labs, imaging facilities, urgent care clinics, and emergency departments. The disadvantage to open office hours include crowding and long waits, waves off busy times and waves off slow times, and its potential overburdening to the staff. So that's open office hour scheduling. Grouping procedures. Grouping or categorizing procedures is another way to approach scheduling. Medical offices may try several ways of grouping before finding the best way. Medical assistant may find it helpful to color code sections for grouped appointments. And you can see I did a little grouping there for you with patients. Okay, now we're going to talk about advanced bookings. Appointments are often made months in advance. Appointment cards should be given to the patient and should require 24 hours notice for cancellation. So let's talk about time patterns. Special problems arise daily and sometimes should be open daily for a provider to deal with minor emergencies. These schedule slots reduce disruption during the day. If possible, block out 15 minutes each morning and afternoon for a break for provider to return calls, verify prescription calls, or answer questions. Okay, telephone scheduling. Often, the manner in which the booking is made makes more of an impact than the convenience of the appointment time. Now, this is what we've talked about, answering the phone with a smile on your face, because then they can hear your smile. So you need to be pleasant and helpful when scheduling over the phone. You need to try to accommodate a patient's requested appointment time if it's possible. If not, be considerate and offer alternative times and dates. And offering 2 choices for a time slot is encouraged so that the patient feels he or she is in control of his or her time. So how many times have you called the doctor and them say, okay, Mrs. Gallagher, we can see you today at 2 o'clock or Friday at 3. Would one of those 2 times work for you? Well, it gives me an option. I love having a choice. Okay, always repeat the time and the date of the appointment at the end of the call and ask if the patient has pen or paper to write it down. You need to check your appointment book or computer screen to be sure it is entered correctly, and write legibly in an appointment book and obtain a daytime phone number for each patient. So that really, the writing legibly is only if you're doing it on a paper book. Scheduling appointments for new patients. New patient scheduling requires time and attention to detail. Tact, courtesy, and professionalism are very important. And you need to request preliminary information so that you know how much time to allot. Offer a patient first available appointment, giving a choice between 2 dates and times. Offer directions or physical address to the office. Provide parking information if it's needed. Options for first payment should be discussed. And you repeat the appointment date and time and thank the patient for calling. Confirming appointments. Many offices call patients the day before appointments. It can eliminate last-minute cancellations. Email and automatic dialers can also be used to send reminders. And you may need to conduct a pre-authorization or pre-certification to determine patient eligibility for certain procedures. There should be an insurance specialist in every office that does this, but it may be part of your job description also. Scheduling appointments for established patients. So this is in person. Most return appointments are arranged when the patient is leaving the office. Have all patients stop by the front desk before leaving in case information is needed or outside scheduling must be done. Ordered tests or procedures can be discussed and scheduled, and offer a patient 2 choices for time and date of these tests. Okay, so establish patient appointment scheduling by the telephone. To find a suitable time in the schedule, only need to know when the patient must return. No need for directions or parking information, and recheck information with patient if it has been a while since the last visit. Okay, so scheduling other types of appointments. So other types of appointments to schedule would be inpatient surgeries, outpatient and inpatient procedure appointments, outside visits, providers, pharmaceutical representative, and salespeople. Okay, let's talk about inpatient surgeries. When scheduling surgery, you call the facility where the procedure will take place as soon as it is planned. Provide all the necessary information and state any special requests the providers may have. May need to provide insurance information and certainly phone numbers. Outpatient and inpatient procedure appointments. You're going to arrange laboratory and radiography appointments for the patients. Have all necessary information handy before calling the facility to schedule, and relay time and place of the appointment, special instructions, also note that in the medical record, to the patient. Some patients require a series of appointments. Try to set these up at the same time, day of the week to reduce risk of patient forgetting. May be responsible for scheduling inpatient admissions or inpatient surgical procedures. So if you're going to your cardiologist, you have a patient coming to see your cardiology clinic, they come in, they have their appointment, and the doctor says, oh, we need to schedule them for a heart cath. You're going to be the scheduling. You're going to be the one scheduling that procedure. So that's what this is talking about. Everything that goes into a patient that needs to leave your facility and then have a procedure or have tests done. Okay, providers, pharmaceutical reps, and salespeople. Okay, it doesn't say this, but if your facility, your doctor needs to have a conference with another doctor, you're just going to block that time out for him. He's going to let you know that, or she's going to let you know that. Pharmaceutical representatives will oftentimes bring sample medications, more than one. The pharmaceutical representative is usually quite understanding and cooperative and willing to wait patiently for a long time for just a short meeting with the provider. If a provider does not want to see salespeople, the medical assistant must be firm yet tactful in sending them away. Do the following related to special circumstances in scheduling. Okay, this is what we're going to discuss. Sorry, I actually am going to just talk to you about these things. So discuss several methods of dealing with patients who are constantly arriving late. Remember we talked about Mr. White? Okay, so I want to point out that emergencies and small delays can happen to anyone, but we're talking about the patient who arrives late consistently. So for habitually late patients, scheduling them for the last appointment of the day means if they arrive closing time, there is no obligation to wait. Some tell habitually late patients to arrive 30 minutes before the appointment time. Make an attempt to work with the patients who have occasional difficulties arriving on time, and do not let the schedule be disrupted by consistently late patients. So how are you going to remember if this person is constantly late? Because you document it in your medical record. So recognizing office policies and protocols for rescheduling appointments. Unexpected conflicts cause patients to reschedule sometimes, right? Remember to remove the first appointment, day and time from the schedule, and then set the new appointment. So if they call and they need to reschedule, you need to take the appointment that they're canceling off the books and reschedule it to the next time that they're available. So discuss how to deal with emergencies, provider referrals, and patients without appointments. So emergencies are one of the many reasons it is helpful to have some blocked out time in the schedule already. Calls go through a screening process, prioritizing so that emergencies see the provider first. Screening is very important and requires experience and tact, and emergencies can be emotional as well as physical. We need to make sure that we're remaining calm no matter what the patient is going through. Because if we're calm and collected, we're going to be able to get all the information we need that will help that patient. Okay, so we're going to talk about some more about emergency situations. The provider should help with the list. He or she should determine what is considered an emergency. Always, always, always obtain the name, the phone number, and the location at the onset of the call so that if you get disconnected, you can get the patient help. Okay, now we're going to talk about patients who are actually ill should be seen that day. That means that 15-minute time that you put in every day for emergencies, this could use that time. The urgency of calls is determined by a list of questions prepared for reference, and they'll give you that at your facility. The patient may need to be directly referred to the hospital emergency room department. Never place emergency calls on hold and stay on the line until EMTs or others have help. Others who are going to help have arrived. So if you have a patient on the phone who you think's having a heart attack, you're going to keep that patient on the line and talking. You're going to be talking to 911, get them help, and you're not going to hang up with that patient until the ambulance has arrived. Please make sure you obtain the name, the phone number, and the location at the start of the call. Because if you get disconnected, you can get that patient help. So we're going to continue on. Patients without appointments. Providers must agree to a policy for patients with no appointments, and medical assistants must follow through with that procedure and policy. Patient requiring immediate attention should be accommodated somehow. If immediate care is not needed, a brief visit with the provider and scheduled appointment for later can solve the problem. Again, you have to be firm, kind, and tactful. Failed appointments. Why do patients fail to keep appointments? Well, you can think about in your own life, why have you failed to keep a doctor's appointment? Well, number one usually is forgetfulness. Patient could owe money and not be able to pay, and so they're not coming because they can't pay. Denial about the condition. It's important to determine the reason for the failed appointments to remedy the situation. If a patient's health is in jeopardy, send a letter by certified mail to explain this and keep a copy for medical record. You're not going to just out of the blue do this. You're going to be asked to do this by your office manager, by a physician, or by the nurse. No-show policy. Some patients do not realize the importance of keeping appointments. Patients who do not arrive is called a no-show. Policy must exist and be enforced for no-shows. Note, the first time a no-show on the patient's medical record and our ledger card. So you need to note that in the patient record. Second no-show, you need to warn the patient, and the third time you consider dropping the patient. Again, this is not your lane. This is office manager or physician's decision to tell you if they want you to do this or not. But you can let them know that they're on their second no-show or if they're on their third time. Provider may wish to charge patient for no-shows or reschedule appointments. The office policy manual must state patients are charged for not showing up, especially if the time slot could not be filled. Be understanding when possible, but do not let a patient take advantage of a provider's time. Make a notation in the patient's medical record in the appointment book or database. Okay, when the patient cancels. By keeping a list of patients willing to take the first canceled appointment, the medical assistant can readily identify which patients to call to fill in that vacancies. I don't know if you've ever had to go to see a specialist and the time to see that specialist, say for example, I call today and they can't see me for 2 months. I can say, could I possibly put my name on a list in case someone canceled? And usually there's a list for that. If the patient simply reschedules an appointment, a notation need not be made in the medical record unless a pattern develops that might be significant to the patient's medical treatment. So for example, say that I have a dentist appointment tomorrow and I realize I have a meeting at work and I simply need to reschedule because of conflict. There's no need to put in there, Miss Marcia called and she has a meeting. No, you just reschedule the appointment. But if I'm habitually doing that, then it may be time to take action and put that in the medical record. Patient processing. The reception area should be an inviting place. Patients need to feel very comfortable there. Visits to the provider can be in times of great stress. Patients have a choice of healthcare providers. When patients have a good experience, they are likely to tell others. Okay, so this is when I want to say customer service, customer service, customer service. The patient does not have to see your provider. They do not have to come to your healthcare facility. There's lots to choose from. Just like if I don't like Walmart, I don't have to go to Walmart. I can choose Super One, I can choose Ball Foods, I can choose Max, I can choose Kroger. The same thing for a healthcare facility. You want them to choose you because that's what keeps your practice in business. When patients have a good experience, they're going to tell everybody, oh, you need to go see Dr. So-and-so. That's who I see, and they're great. That girl at the front desk smiles and knows me by name, and when she answers the phone, she's so nice and friendly. You guys know if you call a doctor's office and they are rude or they're not very accommodating, you're like, I'm not going to that appointment. I'm finding me somebody else. So you don't want to be that person. You want to be the reason that people want to come to that office. The reception area. The first impression is always a lasting one. Now they're talking about you selecting comfortable furniture and having good lighting. Well, you don't get to make that decision, but you can make sure that that reception is clean and put together. Providing recent magazines may be something that you're in charge of. A writing desk or computer for patient to use is a nice touch. Again, that's not your decision. The reason that I wanted to keep this slide is because I want you to understand that the first impression is a lasting impression. So the first thing that they see is the waiting room, and then they're coming to you. So make sure that your waiting room is clean, smells good. If you need things to facilitate that, all you have to do is talk to your provider, or you talk to your office manager to say, hey, could we get some Scentsy in here? Could we, it smells bad. We need to do something about, just bring up those things. Preparing for the patient arrival. So this is what I want to ask you. Do you think that you're going to prepare for your day when you walk in the door that morning? No, that's not how this works. You're already going to know the patients that are coming in the day before. So you may have to pull the patient charts when you walk in the morning time, but if you are getting to work at 7:55 and your first appointment's at 8 o'clock, you're not going to want to pull your patient records that morning. You're going to want to make sure you do it the day before. Okay, so pull the medical records of daily patient appointments. Now, again, I'm going to reiterate, if your first appointment's not until 8:30 and you get there at 8, you have time to pull those patient records, the medical records that morning, and to get organized. Make sure enough progress note space is available. Make sure no health records are on the reception desk so that HIPAA can be followed. So you want to make sure that your desk is clean of all personal information before you start seeing patients. One of the first questions that must be asked is if the patient has traveled to a country with widespread transmission or uncertain control of Ebola. If the patient answers yes, he or she should be isolated immediately. Okay, I don't know why that's on here, but I kept it for one reason. Right now, coronavirus, I wanted to let you know that when you walk into school, they check your temperature, and there's a list of questions that you must answer. And one of them is, have you traveled outside of the United States in the last 14 days? No. Have you traveled within the United States within the last 14 days? Yes or no? So I kept that in there just because of what we're going through now with the coronavirus. The registration process or registration procedures. On a patient's first visit, the staff follows a registration procedure. Okay, so we're going to talk about that. Patient information or registration form is the patient's full name and date of birth, the patient's address and telephone number, the occupation, the name and address, telephone number of spouse, if applicable, the place of employment, social security number, driver's license number, the nearest relative, and referral, if any. Now, we've all filled out these registration forms, but I'm just going to touch base on them. If this is a new patient, he or she will have to sign the facility's Notice of Privacy Practices document. Some practices will have their registration paperwork on their website, and patient's personal, medical, and family history may be obtained by asking him or her to complete the questionnaire. Okay, let's talk about angry patients in the reception area. If you have an angry patient, if it's possible, invite the patient into a room out of the reception area. Present a calm attitude, speak in a low tone of voice, and there should be a policy in place for dealing with potentially dangerous individuals. So I just want to talk about dealing with an angry person. When someone comes at you and they're angry about something, it's not your job to make them less angry. It's your job to keep it in check. For example, say things like, I'm so sorry you're feeling that way. I'm so very sorry that that's happened. So you have to keep that sort of attitude until you get them away from everyone else in the reception area. And then you let the doctor, office manager, someone else will deal with that, not your front desk receptionist will not deal with that. But I want you to understand that what you say isn't necessarily going to make them less angry, but your attitude and staying quiet if they're loud, automatically when you're talking quietly, the other person wants to talk a little quieter. The friendly farewell. Whatever words of goodbye are chosen, all patients should leave the facility feeling that they have received top quality care. Treat patients with courtesy, respect, and friendliness. And patient checkout. Greet the patient with a friendly smile and again call the individual by name. Check the health record to see if the provider wants the patient to return, and you make any return appointments. I feel like those slides should have been switched, so I don't know how they got out of sequence. But you get the point that, you know, you need a great hello and a great farewell. Legal and ethical issues. Appointment schedule can be subpoenaed to the court as a legal document, legal record. Be sure all handwriting is legible and information collected is consistent. Note all no-shows in your appointment book and the medical record. Keep old appointment schedules equal to statute of limitations for your state. That's those paper copies. And that is actually the end of our lecture slide presentation. We are going to, I'm going to be telling you guys about this when we get on the actual live Zoom tomorrow. I want to tell you guys thank you for all your hard work and for staying diligent. I know this is not what we signed on for, but I'm so proud of you guys and I'm so appreciative for all that you do. I hope you have a great afternoon. Bye-bye.